Welcome back to BNC Live. As we close out Sickle Cell Disease Awareness Month, we continue our conversation on a potential cure. Early gene therapy clinical trials are promising, but with a price tag of at least $1 million per patient, will anyone actually be able to afford it? Joining the discussion is Assistant Professor of Public Health at the University of Michigan, Dr. Melissa Creary. Thank you so much for joining us. It is a pleasure. Welcome to BNC Live. Now, $1 million per patient. Why does this new gene therapy treatment cost so much?
That's a great question. Well, new technologies and new therapies tend to have a very high price tag. And when we're talking about this population in particular, there's a lot of investment in trying to make sure that it gets right. This therapeutic, as well as many other therapeutics that go through approval at the FDA, they need a long and intense process in order to get to approval status. And that, in addition to the way that technology runs itself, this new technology around gene therapy, all contributes to a very high cost.
Yeah, it's just so expensive, doctor. And considering the fact that the majority of the people impacted are people that look like you and I, how are they expected to pay for a treatment like this?
Yeah, it's a great question. And I think it's a question that a lot of us are asking that are really committed to the care and treatment for those living with sickle cell disease. There are a lot of challenges that are following this population, like lack of access to healthcare and specialty care and barriers to obtaining pain treatment. And one of the challenges is that there are only 4 medications approved for this patient population. So the fact that there are clinical trials for 3 gene therapies for sickle cell is a huge deal. But on the other side of that, we have to think about, well, how does this become accessible? How can this patient population begin to even get the treatment that's needed that comes as a result of these clinical trials? Well, I think people are talking about this, and I think that the NIH and other governmental entities are really concerned about the cost, and conversations are occurring to contemplate the ways that it could potentially be covered.
Yeah. All right. So federal funds have paid for bone marrow transplants for sickle cell and also brain scans for Alzheimer's disease. Why do you believe federal funds are not being used for this gene therapy?
Well, I think it's still early in the game to say that federal funds won't be. I think that the federal government is known for doing their due diligence and taking some time to figure things out. So, from what I understand, there are conversations that are happening high level between the National Institutes of Health and the Centers for Medicaid Services to find out if, in fact, these costs can be covered. What they're finding out is that even though a person living with sickle cell can cost a healthcare system up to $2.7 million. We can do a cost benefit analysis to tell us that, in fact, if we cover the gene therapy costs, that there is a benefit to do that versus having the patient cost as expensive as they cost to a healthcare system over their life course. So I think people are really considering what that means and still having those conversations.
Yeah, I mean, but even if there are federal subsidies for this and related to costs, I mean, do you think this will still be another issue of us highlighting the health disparity gap between Black and Brown community members? I'm sorry, Black and Brown.
Absolutely.
Yeah, thank you.
Yeah, absolutely. I think that this is a huge highlight when we think about the fact that sickle cell disease already falls pretty low behind in terms of the attention that's given for research infrastructure and particularly for the development of therapeutics. And then we add the fact that it's going to be a cost to actually attain the treatment. So ethically, we do have to ask the questions, is this fair and just? How can we cover these costs so that the people who need it the most are able to have it and have this increased quality of life? And it's a dramatic quality of life that is happening for those that have gone successfully through these clinical trials and are living a life completely free of sickle cell disease.
Can you tell us about that? For those that have completed this trial, what type of quality of life are they now experiencing?
Well, the reports are that people are saying that they have a brand new lease on life, that they can see hope again, that they can fulfill a certain kind of potential that they thought they never would be able to fill once they were diagnosed with sickle cell disease. One of the narratives that you often hear when you're diagnosed with sickle cell disease is that you have a very limited lifespan. So many times people are told that you will only live until you're 30 or 40. And so to have a therapy that not only extends your life, but gives it such high quality, such that you are essentially walking around with corrected genes and normal hemoglobin, normal red blood cells, it seems to be transformative for those that have successfully completed the trials.
Yeah, it's also a very painful disease. Has that improved as well? The pain management?
The pain the pain management for the people that have successfully gone through the trials, they have no more pain. So you
Wow.
can imagine having a life full of pain, which is the hallmark symptom of sickle cell disease, and you have no more pain. It's hard to imagine for those that deal with chronic pain throughout their entire life course for it to disappear.
Wow. All right. So what do we do? How do we get this word out? Should we inform our viewers to contact their Congress member? What do we do so everyone can have access to this?
What do we do so that everyone can have access to gene therapy? It's a good question. I think it's a question we'll continue to be asking ourselves because access to high quality healthcare that's just bare minimum is still such an issue for many of us, much less getting access to these high level technologies and therapeutics. So I think that it's going to require continued conversations with a lot of people from academic medical centers to the federal government to community-based organizations to really fight for and ensure that these populations living with sickle cell disease get the fair access and treatment that these therapies can provide.
All right, Dr. Creary, thank you so much for joining us this afternoon. And coming up after the break, the thousands of Haitian migrants looking for asylum in the U.S. have disappeared from the Del Rio, Texas border. So where did they all go? Coming up, BNC reporter Christine Medella. She crosses the border in hopes of finding some of those refugees and also talking